We have Mayor LaToya Cantrell to give us a briefing regarding fiscal impacts of COVID-19. Mayor, appreciate you being here today. I know you were probably up last night watching that Saints game, which was a victory, and if we can get that home field advantage back in the Dome, we can do it without overtime. So, welcome, Mayor.
Well, Mr. Chairman and members of the committee, good morning. Good morning to each and every one of you. And I really appreciate the opportunity to come and share firsthand. You are no strangers at all to the impacts of COVID-19, this pandemic that has had on our communities throughout the state of Louisiana. And clearly, being here representing the city of New Orleans, clearly no strangers at all. I am here with my CAO, Gilbert Montano, here at the dais with me. And we just come to share based on our experiences thus far relative not only to the pandemic, but how we have had to ensure that we're front and center with our neighbors, particularly Southwest Louisiana. So in the midst of dealing with COVID, we've also shown the love that's necessary to the 12,000 evacuees that we've had to care for, and upward of 6,000 right now in the city, and making sure that they're getting the resources that they need. And of course, I'm in close communication and in partnership with my brother Mayor Nick Hunter over there. So I just wanted to state that. The pandemic has decimated local governments across the state of Louisiana. And not just in terms of impacting local governments, it's impacted our residents that we serve. And with deep urgency, there are resources that we need to be made whole so that we can provide basic city services, again, for the residents and also even the visitors that we do care for. As you know, the city of New Orleans was hit hard by COVID-19 from the offset. We were that hot spot in the state of Louisiana. When other areas were not seeing the hospitalizations, we're not seeing the cases, we're not seeing the deaths, the city of New Orleans was not only seeing them, but definitely doing what was necessary to employ the resources to stem transmission, to save human life, and it has come at a great cost to the city of New Orleans. An example, as you know, first responders, public safety agencies, all of them in the city were right there on the front line. An example, just in that period from March and April, we had our New Orleans Police Department worked over 450,000 hours, and that was just between March and April, so you can only imagine how they've been laboring. Fire department, over 275,000 hours still in the same period. But again, you could only imagine how many hours because we really haven't stopped. EMS, emergency medical services, over 60,000 hours again. Clearly, our public safety team across the board hasn't stopped, but has been given their all. And in the midst of being hit hard personally by COVID-19, EMS, for example, 50% of our personnel was out being quarantined at one given time, but at the same time not sitting back, but providing the necessary care that our residents need. I lost 4 police officers as well, so hit hard. And even in the midst of protests that we've seen across the nation, well, we were not spared in the city of New Orleans, but what we did have peaceful protests. But again, our public safety agencies having to be front and center. 22,000 calls literally per month to 311 and 911. We turned our convention center, as you know, into a medical emergency facility for our region, in which we did have to hospitalize not only New Orleans residents, but those throughout the state of Louisiana, and that is very important. We were the first also to stand up a mobile testing site in partnership with the federal government, the first in the nation to stand that up, providing over 275,000 tests. But we continue to test at the highest capacity in the state, which has really allowed us to stem the transmission of COVID-19, where we stopped that surge not one time, but twice because of the hard work and dedication. Our city hall remained open, fully operational, even in the midst, not being able to close. One, because we still had work to do. And you all are no strangers to me. I've come before you talking about fair share and infrastructure and the needs to spend the federal money on roads and green and gray and blue infrastructure so that we can prevent flooding in the city. Well, I tell you, I had to make sure government kept rolling, because I had to ensure that those notices to proceed continue to move forward. And again, work continuing to happen in the city, which also provided somewhat of a stimulus to the economy while we know still being hit hard. But in the midst of the pandemic, we found a way to get business done and had an impact not only on the city, but again, the state of Louisiana. However, you know, like me, our largest industry in our community and in the state is hospitality. It's tourism, it's leisure and hospitality sector. That's a strong sector in our state, which I tell you, almost half of every Louisiana job in leisure and hospitality is right there in the metro area of the city of New Orleans. So again, by far being hit hard. 40,000 residents continue to be on unemployment insurance in the city, where you know the cost of living in Orleans is the highest in the state of Louisiana. Again, going back to those growth sector jobs in this industry, meaning that it's hurt our people and our small businesses. $2.67 billion. And that is through August, and we know that it's growing by the day as it relates to the small business community. But again, the metro area, with our folks leading in this state in terms of working in the leisure and hospitality industry, again, our economy is being exposed severely. And this industry-specific jobs, our people, it's a deficit, and we have a problem. But as a city herself, now we came into this pandemic, I would have to say, we were rolling. And I mean rolling right on that Mississippi without a doubt. We began a 2020 with a better financial position than we have seen in the city since Hurricane Katrina. It's a fact. We had an expected growth of 1.2% in 2020 with a total of $725 million that we expected to see in 2020, with the fund balance very healthy at $31 million. And again, unrestricted fund balance right around $27.7 million. A Moody rating that we had received increased our credit rating. So it was a good moment and a good point in time as we came into this pandemic. But as a result of all of the resources that we have had to expend, the expenses that we've had to incur, we're now faced with a $150 million deficit. And it's a fact. The sales tax revenue alone, you know, we expected approximately $96 million. This was a pre-COVID expenditure. But now we are faced with a 64% cut in that. I'm going to have Gilbert give you a little bit more in terms of the financial piece. But, you know, I have to just say, on last week, and we've done everything possible to prevent furloughs, layoffs, but everything has to be on the table. And on last week, I had to submit a letter to the Civil Service Commission asking for a waiver that would allow the city of New Orleans to move forward with furloughs now that we're faced and we're at the last quarter of the year. They did approve that request, and so we are moved forward with enacting furloughs that have started for our people. Public safety personnel, as you know, is our greatest expense, but we could not hold back on our public safety employees either. So it's across the board, including myself, including all of our classified employees, and that also includes our unclassified employees. The hurt is real. So, as I look not only at 2020 where we are ending at a deficit, you know better than me, it puts us on bad footing going into 2021. And with the limited dollars that we have been able to receive through the CARES Act funds, we're hurting desperately. And we are not alone. So I'm not just here talking about Orleans Parish. I'm talking about local governments throughout the state of Louisiana who are feeling it firsthand. And your city, the city of New Orleans, is one who is hurting desperately. And as you know, where the city of New Orleans goes, it does impact the state of Louisiana as a whole. So with that, I just want you all to keep in mind, really keep local governments in your mind as you face the challenges that you're dealing with as a city. But I urge you, don't leave us behind. Because if we can't provide the basic city services to allow for our cities to function as we know they need to, then I don't know how our economy will bounce back as we know it can by working together. So, Mr. Montano, it's a pleasure to have you serve in this capacity as the CEO of the City of New Orleans, and I just appreciate you being here with me this morning, speaking to this body. And Mr. Chairman, I appreciate your partnership, and I just thank you for allowing me to be before you, and I would be remiss if I didn't acknowledge Representative Carter and Freeman that are part of the local delegation of Orleans Parish. So with that, Mr. Montano.
Thank you, Madam Mayor. Appreciate your leadership through all this turmoil as well. Mr. Chairman, members of the committee, Gilbert Montano, CAO, City of New Orleans, thank you for this opportunity to speak briefly. To give a little bit more of a depthful perspective and a little bit more into the analytical detail so you can understand really what's been occurring as the committee understands budgeting is really a 3 to 5 year practice. You have to really evaluate your current year, but also see the trending of your recent year and then look toward the next 2 years following that. So if the Chairman indulges, I'll just walk through Orleans' perspective in that regard. As the mayor said, we started this pandemic starting into 2020 very strong, very robust. We had really financially and structurally balanced a great portion of our Orleans budget from one-time dollars to structural balance. We had built into the reserves a significant fund balance. We had received credit ratings from the agencies specifically because of some of those maneuvers, understanding that thoughtful, prudent financial planning was indicative for a future success of the City of New Orleans. Pandemic hit, we understood that there was going to be significant decrease. We all saw GDP, which is an important indicator for the country and the state, drop double digits in Q2. Understanding and seeing where that was going to go, and with the lack of information, even currently with the pandemic, whether there's a vaccine or a resurgence of whatnot, we took the prudent steps to freeze all expenditures, hiring freezes, consolidation, really cut our costs dramatically, almost in the matter of 2 or 3 months, had to cut our budgets collectively from about $30 to $50 million, depending on what period of the year that was. That involved a budget reduction plan. The mayor's goal, as well as the administration, was to stifle personnel cuts all the way to the end. We had been hopeful and we'd been confident with seeing some of the CARES Act dollars. We had some other opportunities with one-time money that carried us through 2020. Now we're in the Q4 of the year. It's vital, certainly for us to make some of these personnel cuts to ensure that we're balanced. What the mayor articulated very well was we don't want to enter a structural imbalance into 2021 and beyond, because there is just a ripple effect in that. We are at the point within our organization and our agencies that we are completely cut to the marrow. We are at the bone. This is not an opportunity to create more efficiencies. We are absolutely going to have to get personnel 63% of our costs are public safety, that's fire, police, and EMS. We had 6 hurricanes, essentially, that we had to prepare for and adjust to. That alone, just an emergency pay cost, is an additional $5 million toward the other direction. So even the capturing of savings requires spending to prepare the city adequately. We have to ensure that the road projects and the FEMA projects have deliverables. We are completely committed to continuing to hire police and fire. We do not want to live some of the past mistakes that were in the past, but the strain upon the city financially, and I say very specifically operationally, is significant. Coming from both an operational financial background, I can assure you that our agencies are cut to where they can. The next stage, as we've discussed, is right now in furloughs, but going into 2021 without even some of that one-time money, we have to look into the layoffs and more significant furloughs, to the point where I worry as an operation how functional we can be to respond to certain calls for service or even delay certain projects. I understand the imperative nature of the catalytic impact that Orleans Parish has for the state, and understanding that quality basic operations is vital for that impact is necessary for us to request and ask anything the Appropriations Committee to do in regards to CARES Act through the remainder of 2020 and into 2021 will be significantly absorbed and prudently financially managed. I assure you that, simply because our numbers are what their numbers are. We can't manipulate them in any way. We had a $150 million deficit. I have 8 revenue streams. I can show the trending from 2 years to the next 2 years. We understand this will be the next probably 1.5 to 2 year projection. I follow and read all the economic forecasts from every potential perspective. I have a little glimmer of hope, but I understand that this is not going to be a next year's solvable issue, and we'll have to carry through at least the next 1.5 through some level of one-time operations to maintain both that structural balance and the operational efficiencies. The need is great, and it's important, and the timing is absolutely right now. We're at just a critical pivot for the city of New Orleans to ensure that we can maintain the operations that our citizens enjoy and need and are required. Absent of what we have to do in 2021, there is great pause and great worry from both the financial and operational aspect for the city of New Orleans. We have done and have transgressed every piece of opportunity that we have, and have exercised every tool as we came to the body for a COI for cash flow opportunities and maintain that integrity. So not to use that and maintain it for what it's used for. We've maintained our rainy day balance, but we still have this juggle both on the Wall Street perspective relative to how we're issuing debt, because remember, we're putting $500 million out in debt, and how you leverage your operational dollars with your reserve funds is basically a science, and we're maintaining that science with as much integrity as we can. I won't elaborate any more other than explaining what the need. I believe I already articulated, and if there's any detailed questions or any concerns on what stages we're in or where we plan to go from the financial or operational perspective, I know the mayor and I are happy to take that.
Thank you, Gil.
Thank you, Mr. Chairman, and thank you, Mayor.
Thank you. Okay.
Thank you, Mayor. We have a couple questions. The Mayor, first off, Representative Carter.
Thank you, Mr. Chairman. Madam Mayor, welcome to the legislature. It's good to see you. I'm so glad to see my mayor, always. And thank you for the work that you're doing, especially in these times. You said a couple of things that stood out to me. The very first thing is that we lost 4 police officers. And I guess as we deal with the economic toll of COVID and all the crises that we're dealing with, the human tragedy side of this, especially in the city of New Orleans and the whole region. Were those 4 officers lost due to COVID?
Absolutely. Yeah, I would not include them, Mr. Representative, if their losses were not due to COVID, and definitely hit our New Orleans Police Department family and really our public safety team significantly, as there were people who were working every single day. But nearly 13,000 cases, 588 deaths to date.
And in New Orleans, I don't know too many people who don't know people who've lost loved ones. I know I have personally. It seems like we continue to lose them. And my heart goes out to those families and all of us, who've experienced this, in the economic toll, the fact that we're having furloughs. Talk about the impact of those furloughs on the city of New Orleans in terms of its growth, in terms of its safety. One of the numbers you gave us, Gilbert, was 60% of the city budget or higher goes to public safety. That's our fire, that's our police, that's our emergent responders. So it seems like furloughs will have a disproportionate impact on our safety. So,
yeah, well, we're having to be very surgical in our approach. So one example is that not many months ago, actually here recently, the city of New Orleans was awarded a SAFER grant for our fire department that would account for over 63 firefighters. And so with that being a grant, we did not definitely want it to be surgical that would allow for us to move forward with those hiring practices because we need to build our force. And so looking at that, but being, again, very surgical and methodical not to lose that grant, so that it's, one, not connected to any of our general operating funds, but some of the grants are where you have to have a particular match to make it work. And so we have been able to work around this particular issue with SAFER to ensure that the New Orleans Fire Department continues to grow and expand as it needs to. Again, being very surgical as it relates to our New Orleans Police Department. You know that over 10 years ago, there was a freeze put on police academies, and I've graduated more under my watch than we've seen in over a decade. So not at all wanting to stifle any growth to our police department, but again, being very surgical in our approach to not want to lose the growth that we have made over the past 2 years. And so we're being very intentional about that. But at the same time, having to ensure that they take one furlough day per pay period, and it's 6 total towards the end of the year, between now and the end of the year. So that is the ask right now, and we'll be moving potentially into 2021, but right now we're looking at the end of 2020. Gilbert, anything you want to add on this?
Thank you, Madam Mayor. Representative Carter, members of the committee, through the chair, there is an operational impact as well, and I'll be very specific. We have on a given day try to have anywhere from 22 to 25 ambulances available for responses relative to the city of New Orleans. A furlough day is going to drop us probably to about 17 or 18 ambulances, and that's just the reality we're going to have to adjust to. So what do we have to do? We have to reprioritize.
Say that again slower. We're going to have to drop from how many ambulances a day to how many?
Anywhere on a perfect, fully staffed, fully ambulance day, 25 on a given coverage area, different periods of time. With a furlough day, it drops it down to around 17. So we have to really reevaluate how we're prioritizing those calls for service, whether it's priority 1, 2, or 3. It's no different on any other public safety impact. It's your deployment strategy. You have all your various districts on the times and the shifts relative to how those districts are provided. You have to reprioritize on how your calls for service are going to be taken, how long an officer can be there, and it's the same likewise with fire stations. You have to have a minimum amount of coverage, and we will always maintain that minimum amount of coverage for the safety of our residents. But those other calls, those other concerning calls, the reality is there just won't be a response availability. And I know the mayor's articulated the 6 furlough days. Where it gives us the greatest pause is 2021, because remember, 6 furlough days is going to save somewhere in the $7 million round. Our deficit's $150 million. So if you just do a simple calculation on what we're talking about on the personnel cuts, understanding that I've cut to the bone on the other operating and all the other types of savings investments we could do, that's where the fear comes in for the impact for that local workforce and what it would mean relative to response times, and most importantly, in many cases, the hurricane preparedness. We have a fully staffed operation happening in Homeland Security, absent of being able to provide for that, is what we're certainly trying to articulate.
And no overtime.
Yeah. And so we have the loss of human life, we have the economic toll, and while we're going through all of those tragedies, the city of New Orleans is still helping respond to the tragedies across the state. I heard that a large number of people from the Lake Charles and southwest area of the state was housed in the city of New Orleans at its peak. What were the numbers, or you have an idea of how many people we helped stand up from the Lake Charles area?
Well, we had over 12,000 evacuees in the city, occupying over 35 hotels at one time. Now we're down, as we went into Delta, Hurricane Delta, we were down to 6,100, although we know we gained some numbers from Delta as well. So we continue to stand up even the resource center and provide, the necessary accommodations to our evacuees, and that's our public safety agencies as well, overseeing and just making sure that we can meet their needs as best as possible. But that does, again, it's a strain on city resources firsthand, no doubt about it.
But we're all in it together. And so as you go through it, as you're going through it, as you're dealing hands-on with the personal human tragedy, with the economic toll, it's good to see the city of New Orleans stand up for the rest of the state. And we're here to make sure the state of Louisiana stands by the city of New Orleans as it goes through these crises. Thank you, Mr. Chairman.
Thank you.
Thank
so
you,
much.
Madam Mayor.
Thank you.
Thank you, Representative Carter. And also on behalf of the state, appreciate your hospitality to the people affected by the storms. Mayor, a couple questions. The bond capacity that was requested, and I apologize, I can't remember the gentleman's name who came to the bond commission requesting the opportunity for a specific project that may have freed up some dollars to the city. Has that been exercised, and has that helped?
So there are a couple of things. You may be talking about the certificate of indebtedness of $50 million. It's pretty much a loan that the city moved forward, taking out as we, from the onset, we kind of looked at the impacts that it would have on the city long term, and really moved very quickly to secure that $50 million that Gilbert mentioned that we're holding. It's a cash, to ensure proper cash flow, but we're wanting to hold it as long as possible. But we look to needing it definitely as we get to 2021. Prior to this pandemic, now in last year, November of 2019, I did bring a bond measure before the residents of the city, a $500 million bond sale. Overwhelmingly, the residents of the city did approve that. And so what that is going to mean, and what it means to us right now, is we're going to sell up to $250 million in bonds, but that's going to act as a local stimulus to our economy to ensure that the projects that are aligned and infrastructure improvements aligned with those bond sales, again, will act and serve as a stimulus. So we were making the right decisions on the front end, and it proved to be very effective, again, in terms of our financial position coming in to COVID. Even looking and digging in every cushion you can find and looking for one-time money that had been sitting for years, we were able to unlock it on many different fronts, whether that was LaSalle Street, Champion Square, getting over $2 million for our property there, whether it was going after franchise agreements that had not rendered resources to the city for years, like CenturyLink that owned us $5 million. We have literally searched far and wide, and we've dug as deep as we can, and we're at the bone right now.
The $150 million deficit, is that through the end of this fiscal year, or currently what you're experiencing, and then it's just going to compound at this point? Where is the 150?
Well, the 150 is right now. It's in 2020. So again, not even looking at 21. However, the impact to 21, 22, and 23 will be far greater. But it's frightening, actually, as we look at 21. But right now, we're trying to balance for the year of 2020. Gilbert, anything to add on that?
Sure. Mr. Chairman and Mayor, if it's okay, I'll try to also articulate the COI and the rationale behind that. So the COI is an important tool, but remember that was completely entirely a cash flow, cash management tool necessary for the city. Our burn rate's about $40 million a month. The last thing we wanted to do was draw down on that COI until we got to a moment where we couldn't provide payroll, and that's essentially the cash flow. Got really tight in August. thought we were going to have to draw down, but we were able to manage through and carry it into 2021. I see us drawing it down in February and replacing it through the rainy day fund as I contort and move some of the funds available to be able to avoid the structural imbalance. As it relates to the projections, the 150 is relative to 2020. What makes this fiscal year so unique, as I'm sure your REC has articulated, there's so many unknowns. We can't look at trending analysis prior years because of all the different unknowns. So we have to take a very predicated approach to understanding which quarter will do what. So in our REC, we're really having a different determinant for each and every quarter instead of an overall analysis and a projection. So where we see 2021, optimistically is very similar in that same number. Maybe it has a little bit higher toward the end of the year as a vaccine or other opportunity has, and that lowers it to maybe $120 million deficit. But what was different in 2021 versus 2020 is I had, as an administration, we had about $60 million in one time from HERAs and about the $40 million right now in CARES Act. I don't have that into 2021, so that makes the cuts even more stringent. But overall, the numbers are going to be very similar in 2020 as into 2021. We may see some uptick in the second quarters, but really not a pre-pandemic opportunity until closer to 2022 and beyond.
And Mayor, you indicated so goes New Orleans, so goes Louisiana, but so goes the hospitality industry, so goes New Orleans. And obviously that is y'all's bread and butter. And I know with the sensitivity to the issue of the pandemic and everything going on, the obvious question is, I know we're in phase 3. Mm-hmm. What, in light of some of the other states opening up more, do you have something that maybe you can offer in terms of what is the outlook in trying to get the economy back up and running in New Orleans?
Absolutely. And speaking to the hospitality industry, that a part of our emergency declarations, both at the state and parish level, allow for our hotels to serve as essential businesses. That being, no hotels had to close at all. However, 50% of our hotels have remained closed, and that's even throughout the summer. So again, being able to be open, not having to close, but no visitors coming to therefore operate. As it relates to the progress in the city of New Orleans and wanting to continue to be on the path of steady progress with no regression, as we're seeing in other cities and states around the country, we're moving in the right direction, again, without any regression. So by this Friday, we will be in 3.2. I started phase 3 over 2 weeks ago, and we structured it as a phased approach, 3.1, 3.2, 3.3, that it will be aligned with that of the state of Louisiana. So as it relates to our 3.1, we have not seen any regression. We're very, just excited about that. We have our public school students back in school now from pre-K through 12th grade as of yesterday. So we're excited about that. And as we move towards our bars, we are opened as well in terms of takeout. Moving towards this week, they will be able to open outdoor only. And so the breweries, we're working very hard with the state to change the language that would allow even breweries to open back up. We have extended multiple grant opportunities for our bars just recently that are preparing themselves to operate utilizing public rights of way, but they can access grant funding to do that. We've done the same for our restaurants, allowing them to expand their capacity, not only just indoor, but also outdoor as well. But we have done the hard work of changing the zoning requirements that would allow for our businesses and bars that are participating in these parklets, as we call them, to remain in place once the pandemic is over. So we're setting up our businesses for long-term success. And so we're really excited about it. So we're not far off at all as it relates to easement of restrictions tied to the state of Louisiana, but we're continuing to be the success story in the state of Louisiana and, quite frankly, the United States of America at this time.
Okay, question from Rep. Big.
Thank you, Mayor, for being here. How did you come up with the 250 in attendance at high school sports, that number? Because Tad Gormley's got seating capacity close to 30,000, about 26,000. That's less than 1%. And there's a lot of high schools and kids in my district. I live in Jefferson, but many of the children in our district, I consider myself part of the metro area. Mm-hmm. How did we get to the 250 number?
Well, working with our public health experts, as well as the association, High School Football Association, sports across the board. We've looked at it, not just looking at football, but looking towards this Friday. That easement will be in place, necessary and aligned with what you're wanting to see.
Where's the easement going to? What is that going to be?
In terms of the
is it going to be
population,
25%?
500. Yes, they'll be able to.
500 in total attendance in Tad Gormley?
In total,
2%.
In total, it's my understanding. But if we remain on par, what it really does look like we are throughout this week, we'll look to further easements come Friday, but not looking at it just in isolation of football. In terms of sports, it's been across the board.
Okay. I coach travel baseball, and you can go to multiple facilities throughout this state on every weekend, and there's thousands of parents and children at these ballparks, and I have yet to hear of an outbreak because of any of that. So my concern is, why are we restricting, it seems like football and other sports? I can understand the interior ones, but the exterior sports, it's confusing to me, and it's confusing to the people of the metropolitan area.
Sure. Well, one thing that's not confusing is the progress that we've made as a city, and coming from one not being a hot spot, but being that model not only for the state but the nation in curbing this virus, but at the same time continuing to see steady progress without any regression. That is the goal. That is what we're doing, and we'll continue to ease restrictions as it relates to COVID-19 as we continue to make progress, and we're doing just that.
Oh, I know we're making progress, because Jefferson Parish has made progress also, and at LaSalle Park there was a soccer tournament and a baseball tournament just last weekend. And
yeah, but we're not the same.
We're not the same in
No,
Jefferson?
we're not. In terms of the rate of spread, in terms of the suppression of transmission, no, sir, we're not the same. The city of New Orleans is leading in the state of Louisiana right now. Yes, sir.
I applaud you on that.
Yeah, because
a lot of those people come from Orleans to play in Jefferson.
Well, they come for school too.
Right. And they go back and forth. So, I mean, in the spread, what's the end game? Meaning, are we waiting for a cure to open things back up?
Well, the end game is making sure that we're the safest city to live and the safest to visit. And so the end game is seeing that our economy is, in fact, opening back up slowly but steady without regression. That is the end game. Also, as it relates to absolutely looking to have a vaccine, which we hope that we'll see in the first or second quarter of 2021. But you know, just like me, that we're in the midst of a pandemic. You also know the impacts that it's had on the people, not only of the state, but in the city of New Orleans. And the city of New Orleans was disproportionately impacted by this virus, with 588 of our people, real lives, human beings, that are now dead now, that have rocked our cultural community, that is the bedrock and the backbone, again, of the city of New Orleans and the state of Louisiana. So with all due respect, we will continue to make progress, and again, focusing on no regression. And we're doing just that. Well, so I hope we're making you proud. And thank you so much.
No, ma'am, I'm not trying to be combative. I'm just trying to find out where we're going. I've got friends that are business owners in your community in metropolitan New Orleans, because when I go places, even though I live in Metairie, I tell people I'm from New Orleans. That's what most of the metropolitan area. And the metropolitan area, all the business community relates themselves as New Orleans. So we need New Orleans to be successful, and we need to get back on track. I'm just looking from the phased aspect that you are. The rest of the state and the governor has moved a little more forward, and people don't understand where they're going. I'm just trying to let...
No, I do appreciate your comments and your perspective. However, I think it's very clear where we're going because we're the healthiest and will continue to be on that path by looking at the data that therefore drives decisions. And what has been also proven, that the decisions that have been made have saved lives, which is the ultimate goal. And with that, the economy will bounce back and we will be stronger than ever. But we cannot do that, and businesses cannot do that if we don't have basic city services. So what you've heard me and my CAO speak to you about this morning is the dire needs of not just our local government, but those local governments around the state of Louisiana, which also includes the metro areas that you're speaking of.
Right.
But as it relates to the city of New Orleans, we're going to continue to see progress, and we're going to continue to open up that's aligned with the progress that we are making. And hopefully you're proud of that because, again, a national model in the city of New Orleans.
Well, I'm proud of the
Steady progress, no regression. A regression will set us back even further, and that would be your metro area that you're talking about. No regression, full steam ahead. You're going to get more participants as you started your comments. So I'll every time we ease, I'll think about you and do a little dance. So thank you.
You think
again.
about me and dance? Well,
I sure
appreciate
will.
that.
Absolutely.
There's
Do
many.
a little G for you.
I'm not asking you to dance for me. I am asking that all of these people in this room have municipalities in their area that are suffering the same hardships. And as much as New Orleans is, other areas, we want you to kind of step up and start opening up the city, because New Orleans is an important economic driver to all of us in this state, as well as Jefferson Parish, the entire metropolitan area, Baton Rouge, Shreveport. All of them have their areas, and all of them are struggling.
Absolutely, but none of them are like the city of New Orleans.
I understand that.
No,
They're just looking by having the different phases. People just don't understand. People like black and white, and people they don't like guessing about what's going to come up. So,
well, unfortunately, we're in the midst of a global pandemic.
Absolutely, will. But
that
you
has
said
required us to be fluid in our approach and in our actions.
But you mentioned, things will change when it ends. We don't know when it ends. This may be the course of life. This may be what we're stuck with for a while, and we've learned how to adjust ourselves from the beginning. In March, we didn't know what we were dealing with, and people have adjusted their lifestyle and the way they are differently to the way it is today. So we understand the risk, and people that go out understand the risk and have moved on, have tried to move on in the new normal. I hate the term, but it is a new normal.
Sure. I think if we understood the risk, then we would be in better conditions than we are right now, and particularly when you have the city of New Orleans being that hot spot at a time when no other impact was happening throughout the state. So if we really understood, we would have been able to stop it in its tracks, but we did not.
We did not.
Yeah, we did not. So we will continue to make progress, be driven by data, and show you that the city of New Orleans is on its way back along with our economy, but understanding that we can't do it alone. So without the desperate resources that we need to provide those basic city services and to have the events that you're talking about,
right.
You need operations. You need a city to run. And right now, sir, as I mentioned, I have my people going on furloughs along with myself.
And as other people.
And that is not happening in other parts of the
That's
state
extremely
as
hard
well.
to do through right now. I agree with you on that. Have you consulted other economic engines like GNO Inc. and the Jefferson Chamber and the other entities in the metropolitan area to get together to work with them on a plan to reopen, or is it just your administration's plan?
Oh, no, I have an advisory panel that is made up of representatives across the city, and even representing the metro area as well, front and center with me on a weekly basis. And I also used to have daily calls with my hospitality industry. Now it's weekly, every Wednesday at 1 o'clock. So that is just an opportunity for them to engage with me firsthand, and for me to do any troubleshooting that they need me to do so that they can operate as best that they can. So open dialogue, open communication is something that I do absolutely every single day.
I know it's a tough. Thank you for being here. I appreciate it. I worry about the restaurants because I know I've heard that almost 50% of the restaurants may close, and that's a scary proposition. People come to Louisiana to enjoy themselves, and especially New Orleans.
Sure, restaurants are open, and one of the things we were able to do to extend that lifeline was, one, to get FEMA to approve a mass feeding program of 1.8 million meals per month in partnership with over 70 restaurants in the city that would therefore make these meals, and they're being delivered every single day to families throughout the city with children, homelessness, mental health, any special needs. So it is the first comprehensive mass feeding program that FEMA has ever extended and approved, and they've done that now going on multiple months on behalf of the city of New Orleans. So that was a win-win, and that's how we operate, through the lens of, one, creating that win-win and balance, being driven always by data and showing results.
No, you mentioned mental health just now, and it's one of the things I worry about is at the cost of this virus. You've driven, the front page of the paper yesterday was about the increase in alcoholism in women. And I think it's in the entire community. They're having record alcohol sales. So people are coping with this virus in a different way, which
in so many different ways.
And that's the mental toll.
It
causes a physical toll on this community. And when people feel everything's going downhill and they don't see any hope, they turn to other measures. And that's one of the things that work made. We want to try and give people hope and get them back up and going. And I appreciate you being here today. And I'll dance with you when we get this over.
I bet you will. I bet you will.
Thank you, Mayor Cantrell.
Absolutely.
Rep Big can dance now. He's got moves.
Well, that's what I know it. I know it. That's why I had to put him out there.
Prior to his question, we didn't really have anyone else. Now the board is lit up. So to be respectful of the mayor's time, I ask if we be somewhat judicious in the questions. So with that, let's go to Representative Lyons.
Thank you, Mr. Chairman. Good morning, Madam Mayor.
Morning.
I just I have one question, but I'm going to be brief and open and publicly. 2020 has been a different year, and we started this year celebrating in the region the first female mayor of the city of New Orleans, as well as the first female parish president of my parish in Jefferson. Through that time, you have formed a wonderful working partnership that I want to publicly commend you for, that has been outstanding, if you will, for a region. Even though we talk about New Orleans, as New Orleans goes, the city goes, but the region goes. And New Orleans-Jefferson partnership is a wonderful stability mechanism for the state. And I want to thank you for your partnership with her, with Cynthia Lee Shang, our past president. It's been great. On the onset of COVID, no one knew this pandemic would be as hefty as it is, taking a toll on individuals as well as the community and our economic stimulus in this state. But throughout the onset of it, your working partnership worked well for the region. It works well for us now, and I want to commend you publicly on doing that. And I wanted to ask you particularly about the CARES Act funding. Up to this date, I know Commissioner Darden spoke to us at joint budget several times about the remaining funds that were there. Has the city of New Orleans been made whole according to the formula yet in the CARES Act?
Oh, no, not at all. We have submitted all of our expenditures as requested in the various tranches. We have received less than $60 million. There is millions that are on the table associated with the expenditures that we have submitted. Gilbert, I know we talked about even preparing for the fourth tranche, and that would be, we call the leftover funds, hoping that those dollars would be able to reimburse the city for expenses that have already been approved by the state. So we were expecting an upward, 150 million, and we're looking at 53 million at this time. And Gilbert, anything to add on that?
Mr. Chairman, members of the committee, I think you articulated it well. Our qualified expenses, meaning what we qualify for based on all the criteria from DC down to the state, is about $200 million. To date, we have not received our tranche 3. I think that's forthcoming. I think the deadline was the 15th. We're set to receive, when that close out, as the mayor said, less than $60 million. So our expenses are a very significant ratio as compared to what we've actually qualified for over the $200 million.
So my question is now, is there a light at the end of the tunnel? In regards to that, is there any hope that somewhere, somehow, there's going to be some effort made to try to balance that and rectify that deficit that's there according to what was proposed and what is there?
Well, I hope that there's light. You all represent that light. Well, we'll see how bright it shines is what I'm trying to figure out. However, we remain hopeful, but as we have been hopeful over the past several months, it hasn't come. And therefore, I've had to move forward with furloughs because I can't run a city on hope. And I have to ensure that we're fiscally prudent every step of the way. And so in order to do that, we've had to move forward again with making the cuts that could extend themselves into 2021.
Okay, and thank you very much. I want to know that because particularly as we battle and go forward with these funds, it's important that the local governments be made whole, and this is part of the early debates on the $1.8 billion that were there, that local government. It was my contingency that local governments be given an opportunity to meet whole before other things happen. But thank you for your testimony, and Madam Mayor, as always, great to see you, and thank you for your leadership.
Thank you, Representative Lyons.
Thank you, Mr. Chairman.
Yeah.
Thank you, Representative Lyons. Representative Freeman.
Thank you, Mr. Chairman. Thank you, Mayor, for being here. Thank you, Mr. Montana, for being here to give us this update. I know we've had a lot of updates, and I just want to tell everybody up here that Mayor Cantrell is also my constituent, so I take her calls whenever she needs me. So I just want to, a couple things. You talked briefly about, what we did as a city for caring for others who needed to come be in our hospitals. And I know, I don't know if you want to share with the committee a little bit about what Dr. Avegno did as far as helping other areas and making sure some of those patients that were in other regions who needed to be hospitalized. I didn't talk to you about this before, but I want my colleagues to understand how much our city did for some of the sick people in their communities in the hospitals. And
Well, absolutely. Well, one is setting up the medical facility in Region 1, which Orleans is a part of, was not only because we were a hot spot, but also looking that if there was a need, and based on the rate of spread and the virus, it clearly was the right thing to do, because as we saw the rate of transmission and spread throughout parishes throughout the state of Louisiana, the city of New Orleans, with that, we really became that location, not just in the emergency medical facility, but of course in the hospitals that we have throughout the state, throughout the city of New Orleans. So definitely it's always good to give, and especially at the time of real need. And we'll continue to do what it takes and what's necessary, but understanding we can't do it alone, and it's come at a real cost to the city of New Orleans.
We're having a couple mic issues we're trying to fix. Please proceed, Representative Freeman.
She's not on.
Oh, she's... Hey,
Mary's?
there you go. Try now.
Mary.
No, try on yours.
Okay, thank you. And I just also wanted to reiterate the wonderful job that you've done is helping the restaurants and the businesses, because owners have called me, and it is hard, and probably 50% of the restaurants will sadly not make it because it's a small margin. But the ones that are using the grant program to be able to expand, to have their services, in their parking lots, on the sidewalks, are very grateful for how we're doing it. And so I want my colleagues to also understand that the businesses are open in New Orleans. I know we're doing it differently, but it is happening. And then this specific program that has the federal grant for delivering to those people who are homebound has been a huge success. And like you said, we were on the forefront of doing that, FEMA doing that for the first time. And the company that's doing that delivery is based out of my district company. So that's a business that's actually growing in my district right out of Broadmoor, is the guy who founded it. So I do think things are happening in the right direction. I appreciate what you're doing, and I, of course, am continuing to always advocate for the CARES Act formula and people to understand what we've done in the city. And thank you all, both for being here to give the update.
Thank you so much.
Thank
for
you,
your
Mr.
leadership.
Chairman.
Thank you.
Representative Freeman. Representative Marcel.
Thank you. Good morning, Mayor.
Good morning. Good to see you.
Pleasure seeing you again. You mentioned something when you were talking about a SAVER grant for firefighters. Did you say SAVER?
It's a safer.
Safer.
Safe, SAFR. It's safe administrative fire response.
Yes. FAFR.
Tell me how you
It's a
spell that.
federal grant.
SAFR.
SAFI.
FR.
Okay. I.
R. It's
Okay.
a fire response.
Got it.
grant.
I just wanted to know what that grant was, number one. And I want to thank you for your leadership. I think you have allowed the data to drive your decisions in New Orleans and not depend upon anyone to make those decisions for your parish. And I just want to say thank you for that stand-up type of leadership. And because of that is why the numbers are not progressing in your city. And I just, even though I am a Saints fan and I want to get back into the Dome, I do clearly understand your decisions and want to thank you for that. Now, one other question. You talk about furloughs.
Mm-hmm.
You started that on last week, you said?
Yes, ma'am.
And the anticipated...
Well, I made the request. I
You
made
made
the
the
request
request.
to the Civil Service Commission. They did hear the matter in a special meeting. They granted the request for the waiver. We have submitted documentation, and for this current pay period beginning October 10th, the furloughs will start. It's 1 furlough day per pay period, and we have 6 pay periods between now and the end of the year.
So it amounts to 6 days of pay. And one of the things I liked you
Little
said,
over
you said
6.
from you on down, right?
Oh, yes, ma'am.
So you included yourself.
Oh, yes, ma'am.
Okay. All right. It's unfortunate that we're where we are, but as you have said, it's a global pandemic, and none of us knew what this pandemic would do or how to handle it. And I think you've done a yeoman's job in your response to it. Although I'm ready to get back in the Dome, I want you to listen to me clearly. Okay? Thank you so much. Thank you for being here today.
Absolutely.
And we'll do what we can to help the city of New Orleans sustain itself through this global pandemic, because it does impact all of us throughout the state.
Thank you so much, and it's other municipalities as well. So I appreciate it.
Thank you, Representative Marcel. And again, the mayor, I think, has other engagements and needs to head out of here around 11:15, I think. So we just kind of be mindful of that as well. Representative Romero.
Thank you, Mr. Chairman, and thank you, Madam Mayor, for being with us today. I just pulled up the LDH website and looked at your positivity percentage over the last 2 weeks, and it's just a little bit over 1%. And we know that if it's under 5%, then the governor has said that you can for the most part, open your hospitality. And I know that I represent a rural area, but we have done that in Jefferson Davis Parish and have found no bad response by doing that over the last 3 weeks. And I guess my question to you is how do you make a determination to continue to keep your hospitality industry closed when clearly you're probably one of the lowest in the state?
Sure. Well, we definitely are the best in that regard, based on the decisions that have been made. and good to see your progress that you spoke about where you are. The priority in the city of New Orleans has been to ensure that kids attending public school return to the classroom. Every day out of that classroom is a problem in that home for that child, and even as it relates to activity on the street relative to domestic violence or violent crime. It's very important that our kids are in school. On this week, we onboarded, and I'm happy to say, 5th through 12th graders back into the classroom. So now fully complemented pre-K through 12th grade, inclusive of our public school, our private, and of course our parochial schools. We're wanting to ensure that steady progress remains in place given the fact that we've onboarded hundreds of kids back into the classroom. That's not just around the students themselves, but of course the faculty, staff, all that it takes to render care to our children. So in that regard, also with the expanded testing that's necessary, that the community, the education community really did want to have in place to get our kids back into school. They were afraid to get back in there if there was not some level of assurance around testing capacity, and rapid testing. So working very hard and diligently to ensure that those measures are in place, and we'll continue to measure the data that hopefully will see continued and steady progress. I am confident where we are right now, and even onboarding 5th through 12th this week, that we are definitely on the path to our 3.1. We are in phase 3, and we're moving to what I call 3.2 on this Friday with further easement of restrictions. The hospitality industry is operating. Our bars absolutely have been hit the hardest, no doubt about it. But at the same time, we also understand as it relates to the risk and the rate of spread. But being able to open our bars back up, they're doing takeout. They're going to be able to do outdoor patios and the like, and extending them the resources to do that effectively. So we'll continue to monitor and see growth. But what we are seeing is that with sustainable tourism practices, and that people want to come and visit, they want to go where it's safe. And they are seeing that in the city of New Orleans by our rate of spread being down, of course, our ability in terms of hospitalizations, all that, we're just doing very well. And so this is just proven to be an asset as visitors look to see where they want to go. They do look to see where leadership is guided by data, and they're making great decisions that will impact, of course, their lives and that of the people that live in our city.
Do you have a fear that because you're holding back on opening that hospitality, that you're putting fear not only in your constituents' minds, but also all of the people worldwide that want to come to New Orleans, and that they may not come back the way that they did before? And do you have a plan to be able to bring those people back into New Orleans again?
So first of all, I have no fear that the city of New Orleans will not bounce back. She always does. She always has. And thank God for that, because she leads the state of Louisiana. So it's one thing that people love our city. It's a world-class and an international city. And we do believe that we'll bounce back better than we were before. I believe that. And building in assets even to do that for our cultural bearers, expanding pedestrian malls, the ability, to perform and vend in ways that were not even accessible pre-COVID. So being very intentional about what the new normal looks like, but also I see businesses absolutely being able to bounce back. I know you said holding it back, but you know what? We have been holding back that virus that will allow the city of New Orleans to open back up and again be the safest place to live and that to visit, which is very important. And also when you think about the disparities that exist in the city of New Orleans, and that's why the priority was, again, getting kids back into school, public children back into school, very important. But I just have to say, that we're moving in the right direction. And no, I have no fear in my heart or mind in regards to that at all.
Good. And I also want just a comment. Like I said, I represent a rural area, but I can tell you that 2 of my cities have already furloughed people in their cities because they had to. They did what they had to do to try to get their budgets in order so that they could get through this process. They've also gone forward and made sure that the economy was going to come back by opening their bars and by getting their restaurants open for sit-down customers and all of those other things that they had to do on the economy side of that to make themselves whole without having to come before the Appropriations Committee. I bet you, if I had to guess, every city in this great state is in the same situation that you're in. Maybe not as desperate, but in the same situation. And I would be it's going to be difficult to prop up New Orleans and not hear all of the other ones come forward and ask for the same dollars. On a positive note, I come from Jefferson Davis Parish, which was hit twice by hurricanes, and we appreciate that your city was able to take some of our good people in and take care of them until we can get back to normal.
Absolutely. And rural communities, they matter. They matter very deeply, not only to me personally, but of course to the state of Louisiana. But I also understand that has a lot to do with population. And so in the city that has the largest population in the state of Louisiana, and of course when you look at the workforce and the numbers there that drive the industry that you love so much, there's no other parish that's hurting like the city of New Orleans. And not only that it has expended the resources that it has taken to meet the daily needs of our citizens, as well as our visitors, as well as those that we're caring for right now. So we'll continue to do what we do.
Thank you. Thank you, Mr. Chairman.
Thank you, Representative Romero. Representative Dubuisson, and we're getting close to up against the clock.
I'll go very quick. Thank you. Thank you, Ms. Mayor.
Morning.
Good morning. I'd like to ask you, since your decisions are driven by data, do you have figures today, or Mr. Montano,
Yes.
on how many businesses have actually shut down already?
In terms of shut down, very few have shut down permanently. I know that looking at our data, that our businesses collectively in terms of revenue that they would normally generate is an upward of $2.67 billion in lost revenue right now. And so when I look at that, and those are businesses across the board that absolutely pay into the city's coffers, so pays, sales tax. So looking at that and doing the numbers, and when I advocate even at the federal level for all of our businesses, it's at that baseline.
Okay, but you don't have a number for me
In terms of businesses that have closed,
Right.
no, permanently, no,
Okay,
and it's not a large number.
I'd be interested just for kicks. The other thing is Mayor Cromer of Slidell and Parish President, oh my God, Mike Cooper have said that their numbers are actually up. They're better than before COVID, and it has to do with just a shift, perhaps, in businesses that are doing so extremely well.
The economy has demonstrated that once you're ready, you're ready, meaning it picks up, and so it's a matter of continuing to move on that path and on that trajectory with a balanced approach that keeps people safe as well as keeps your businesses, giving them the ability to
I don't mean to interrupt,
open.
but
So
I
it's a
know
balance.
we want to push this forward. So no, my point being though, are you seeing any increase in other areas that would help to decrease the deficit? If it's tourism that we're saying is down so much, which certainly I understand. So are numbers not better in some respects?
Well, you have grocery store, the various
Alcohol,
sectors
grocery, right.
that have done better
Right.
now than they did pre-COVID. So your grocery stores are an example of that.
Absolutely.
That, of course, never had to close. The essential
And Home
businesses,
Depot, those
so the
types of
essential
stores.
businesses, and then you have business owners that have been able to pivot into other sectors, their business into other sectors, whether that's sanitizing, different locations, facilities, you name it.
So what
We've seen
effect is that having on this deficit number, though? I mean, if those are up, then how is the deficit just increasing?
Well, because you're losing in other areas greater than you did pre-COVID. So because the businesses, the grocery stores, for example, are doing better than they were pre-COVID, and hopefully they're submitting their revenues to the city, in a timely manner, but the loss in those other categories are just so dire that it's had an impact on our bottom line.
And so
It's just a fact.
The impact of opening up more and the CARES Act and the revenues that are increased, you still only think there's maybe 30 million that would be affected on your deficit number? Is that because you said like maybe 120 might be the best number that you would hope for? But I'm just wondering, with all three of those
You're
things
talking
combined,
about with further cuts that we have to do. That's where he spoke about the 120.
About 2021.
I think so too. You're speaking about 2021 going into 2021.
right? Mm-hmm.
Yeah. Well, right now for 2020, it's 150 million, and with.
But I mean, we still
without
have a little hope
filling any
with the rest
gaps.
of the year, right?
I'm sorry.
We still should have a little hope with what remains of this
Well, we
year.
are hopeful. I mean, hey, hopefully so, but I can't run a city on hope alone.
I get
and
it.
therefore, moving forward with furloughs was something that we had to do. But also, as we look to this being the last quarter of the year, hopefully we can bring some spirit, Christmas spirit, that will be relevant, I think, to us at this time. I mean, that's hopeful. And of course, with further easements happening, I mean, I'm hopeful to that, and that will have an impact not only on the businesses but the city's bottom
That's my
line.
point,
So that's the last quarter.
right.
A little bit hopeful given where we are.
So I mean, hopefully it won't be as dire as what it looks like right now. And I mean, I certainly hope that.
I hope
love
it,
New
I'm
Orleans.
telling
I'm born and raised in New Orleans, so I love it, and I think everybody here, feels the same way. It's the heart of our state, and we want you to succeed. So,
Thank you.
thank you for being here. Thank you both.
Thank you for your question.
Thank you,
Thank you,
Representative
Mr. Chair.
Dugas. Thank you, Representative Dugas. Representative Buckala.
Thank you, Mr. Chairman. Mayor, how many employees does the city of New Orleans have, and how many will be furloughed?
So we're looking at about 5,000
Employees, total employees?
5,000, sir, that will be a part of the furloughs. Yes, sir.
Well, does that mean every employee is going to be part of the furlough? So you have a total of 5,000 employees, or less than 5,000, or more
We
than?
have 5,000, more than 5,000 employees that will be impacted by the furloughs.
Who will not be impacted by furloughs?
We have some external, well, in terms of the city, it's all unclassified and it's all classified. And that's inclusive, of course, of myself. It's also including the New Orleans City Council that is also impacting their unclassified employees. We did request that other external agencies follow the suit, follow the lead of the city with furloughs. We have about half a dozen that agreed to do just that. So if I'm talking about one example would be our criminal court, one would be our municipal and traffic court, another would be our Orleans Parish Communications. So multiple external agencies that have also agreed to take furloughs that would help, again, with the bottom line.
Okay, so bottom line, I'm guessing.
I think just to answer your question, I think that there's only about maybe 350 excluded from the furlough, and the rationale for that is those are either federally or FEMA granted positions. So if we were to furlough them, we would actually lose money and leave money on the table.
How much do you expect to save by the furlough of 5,000 people?
It's approximately a little over 1.1 million a day, so close to $7 million.
Yeah.
And you said you're 150 million in the hole or 120 million in the hole right now?
For 2020, that's exclusive of what we've done so far through this year and the one-time money.
Well, it's about 10% of your budget, 15% of your budget, which is kind of what I think everybody else in the state is off 10 or 15% of the revenue stream. It seems like where people I go say, but anyway, so that's kind of where you're at.
We're closer to the 20%.
Yeah.
Okay, I'm looking at a total city budget of $1.1 billion, and you're 100 and how much down?
We're 150 million.
All right.
Our general fund is approximately 725, though. The 1.1 billion is inclusive of your
What we're
enterprise
talking about, 5,000 city employees perhaps losing one payday per.
Yeah, that's
pay
what we
period.
said. That's what we said.
Okay. I mean, I just don't want to forget the probably 50,000 people who lost their jobs. That's every days of employment throughout the last 6 months. They didn't lose one day of pay period. They lost a job. And I don't think we ought to always just sit here and talk about government without talking about the people who are impacted by the restrictions we have placed on them have caused people to lose 100%. They are on furlough every day. And I don't think we should miss looking at that as well. Now, in a year from now, in hindsight, we'll look back and figure out where we could have done better. And if there's a pandemic 5 years from now, we'll remember those lessons learned.
Hopefully.
Going forward, and I commend you guys for being y'all were the first spike, and y'all were the only spike you had. Basically, was the first spike. You had a couple little bumps, but you didn't have the big spikes. And quite frankly, I think the infection rates in Jefferson were much worse than you when you look at the entire pandemic. I can speak to my parish. The first day they were allowed to open schools, they opened schools. I can speak to my parish who's looking forward to the first day that the governor will allow them to open bars. They're willing to open the bars. But everybody's got to balance things as they see fit. And I can just tell you, I think most of this state wants to put people back to work as quickly as possible, even if we have to balance the risk and the loss. So I'll finalize with one thing. You guys want 150 million. Where do you want us to get it from? Because it's going to come from health care, or it's going to come from education, or I'm going to have to pull it from Lake Charles.
You can pull it from the CARES Act money that you received.
Which the CARES Act money is supposed to be divided equally based on population and infection rate across this state. So if I pull it from the CARES Act money we receive, I got to pull it from other people who the formula says are just deserving of you and have lost just as much residents as you. Percentage.
That's not true.
Okay, well, we'll have a difference of opinion on that. Thank you, Mr. Chairman.
Definitely.
Thank you, Representative Buckle. Representative Cruz.
Mayor Cantrell, I appreciate y'all both coming down here. You mentioned your goal is progress without regression. What does that mean to you? What's no regression? Are you talking about hospitalizations, deaths, cases?
All of that. All of it. Absolutely. Death being number one. Yes.
Okay. But
death being number one, which we're doing very well.
Well, what I'm asking is, it appears from all the data that the cases, even though we're still getting cases, the rate of death and hospitalization is going down from each of those.
It really is.
So I don't know if that should be a metric that's primary.
It'll always be a metric when you're talking about human life. However, it's not the leading measure considering where we are now as it relates to daily caseloads. On all of the indicators, the city of New Orleans is doing well because of the decisions that have been made. And so steady progress, no regression, that's exactly the goal, and that's exactly where we're headed.
Why are your restrictions more than the governor? Why do you see that as appropriate?
Because it's appropriate because the rate of spread and the deaths were disproportionately impacted in the city of New Orleans. That's
Initially, are they still today?
Yes, sir.
I thought from those statistics it showed that you're doing significantly better.
Oh, we're doing much better, but when you look at, again, the deaths and the rate that we had in our city, and actually those who lost their lives, disproportionately impacted, sir.
Well, I'm going to have to piggyback a little bit on Representative Bacala's statements there, because your ask is pretty big, and I have a feeling there'll be bigger asks in the future, but where does it come from is really going to be a hard thing to determine, because there are a lot of people out there going to go, well, wait a minute, why did they wait so long to open up? Their revenue's down because they didn't, and they want money that should be coming to us. So how do you...
Our revenue is not down because we did not open up. Our revenue is down because of, one, the response, how we had to respond to the virus being a hotspot in the city of New Orleans. The expenditures that were submitted to the state of Louisiana, even in the period of spread, we have not received all the dollars we should have received. And so when you talk about where do you get it from, you get it from where those dollars were given from the federal government to the state of Louisiana, in which the state of Louisiana ensured that $991 million dealt with the expenses of the state, with the same indication that was expected for the $800 million that was appropriated for local municipalities.
Mayor, what I'm saying is if you opened up more quickly, you might be able to recover some of that revenue within the city itself instead of relying so much on appropriations here. That's what I'm saying.
But we're relying on resources that were given to the state of Louisiana to help local municipalities deal with COVID-19, and that's exactly what we have done.
And I understood the formulation that Representative Bacala did, so we'll just have to touch base on that later. I am curious why I know this is a difficult decision and hindsight's always better, but why you didn't lay off some of these employees earlier when they could have taken advantage of unemployment and some federal dollars instead of waiting this long?
Well, one is that Representative Bacala, who you said you were piggybacking off of, he referenced the unemployment rate and how individuals have been furloughed for every day, laid off.
Sure.
Well, one, wanting to ensure that city government that employs over 5,000 people would not be one contributing to massive layoffs. So trying to keep people working as long as possible, which has an immediate impact on the livelihoods of the people that live in your city. So trying to keep them going. And that's exactly what we were able to do.
And I definitely understand that. It's just financially we look at it and go, well, that money may have come from somewhere else, but now we've got to deal with it in arrears. So it just seems like it's a difficult challenge there. So I know that your tourism is important and all that, and I've seen some, I guess, bad press, or let's just say negative press lately about some big developments going to Mississippi. Do you think that's predictive of the future? Some people thinking, well, we'll relocate some of these entertainment venues somewhere else?
Well, there's no place like the city of New Orleans.
Well, I'll agree with you there.
And so just as she has bounced back during the yellow fever pandemic, she'll do just the same. But there's no place and no substitution in the United States of America for the city of New Orleans. So.
Well, okay. Well, let's go with that history.
She speaks for herself on that.
Last thing is, you mentioned something about when the pandemic's over. When, in your estimation, can we say the pandemic's over?
I don't know.
I mean, you don't have any idea, hey, if we get to this point, I'll say, in my mind, the pandemic's over, the war's over.
You don't know, so therefore you can't expect me to know. But what I do know is that when we have a vaccination, that we could definitely all be able to live our lives without fear. And so hopefully the scientists are hard at work, and we'll see a vaccine coming our way so that we all can live the quality of life that we deserve.
Unfortunately, LDH tells us those vaccines may only good for 90 days. So
I have no idea.
I'm concerned that won't be the big panacea we think it's going to be.
Maybe not, which is a problem.
Okay. Thank you, Mayor.
Thank you.
Thank you, Representative Cruz. There are no other questions other than Representative Carter has asked for a brief comment.
Thank you, Madam Mayor, for coming, and thank you for the patience to answer my colleagues' questions. And I think you said it best at the end. There's no place like the city of New Orleans. And I'd like to remind my colleagues that the city of New Orleans is not like Jefferson Davis Parish. It's not like rural Louisiana. It's a major city that, on top of having hundreds of thousands of people, we have millions of visitors a year. And thank you, Madam Mayor, for making local decisions based upon local factors and local expertise, and continue to do good work. Thank you. Madam Mayor.
You so much. Thank you so much, Mr. Chairman, and to the entire committee.
Thank you, Mayor. And I apologize. There's one other outlier, Representative McGee.
Thank you, Mr. Chairman. In light of Representative Carter stated. I was just, is Algiers in the city of New Orleans?
Of course it is.
Although they're not paying their taxes, so they. Mayor, we appreciate your time. We understand and fully appreciate the challenges that you have before you, and appreciate you coming before, and we'll do whatever we can as best we can to help. But
Thank you so much. Thank you
all,
so much, Mr. Chairman. Thank
Tanya.
you so much, Mr. Speaker.
Thank you.